The show here, as we've talked to a number of different doctors specializing in different parts of orthopedic surgery, and now we bring in the head honcho himself, and that is Ray Zinicola, who joins us. He is the practice administrator here at OMNI Orthopedics. Ray, thanks for joining me today.
Well, thank you, and welcome to OMNI.
Well, it's been great to be here. It's been very welcoming. Got a nice soft drink from you guys, and I know all of our staff here has gotten coffee and everything.
Good.
So we thank you guys for that, and thank you for having us. So I guess we'll start things off with a question that I'm sure a lot of people want to know about different healthcare fields right now, and that is the effects or lack thereof of the coronavirus and what you guys have seen, how you guys have adapted, and how you guys continue to roll here in Belden Village.
I think, unfortunately, COVID has scared a lot of people, and as a result, people didn't know whether they should keep their appointments, whether they should come. So we've tried to adapt as best as we can to make people feel as comfortable as possible. We're constantly cleaning down our surfaces. We're checking temperatures to make sure that people who are coming into the building don't have an indication that they're sick or not feeling well. And we have a small questionnaire we ask everybody. And if somebody is ill, we will ask them to reschedule. So we try to make people who do come into the facility as comfortable as possible. Now, I don't have it on now, but everyone here who is employed here is wearing masks. And we try to make sure that we're as welcoming as we possibly can be, and yet still be protective of everyone who enters the facility.
Absolutely, and I know that's been a really hard thing for businesses to do, and I know that, I mean, it's scared me from going to places. I mean, when you go to somewhere that's, elective surgery, I mean, it's, that's, you're going under the knife a lot of times. So, I mean, that's a scary thing.
It is a scary thing, and we try to make people as comfortable as possible, both here at OMNI and at our surgery center, Oasis Surgery Center. We want to make sure that everybody realizes how seriously we take the situation. I'm 64 years old, and I've never encountered this before, so this is different for everyone. And we're trying to be as adaptive as possible and as complete as possible in trying to avoid the virus in every way we can.
Ray Zinicola is his name, and he is the practice administrator here at OMNI Orthopedics at Belden Village. And Ray, when you look at where orthopedic surgery and orthopedics have come in the time that you've been here, what's really been the most impressive thing in your mind in terms of advances that continue to happen year in and year out?
A couple things. Technology has changed everything. And in orthopedics, we've become a digital age. So our x-rays are digitized. We used to have film for everyone's x-rays. Well, right now it goes through a computer. And with that computerization of x-rays, you can do a lot more with it than a flat piece of film. So the docs can enhance those images so they know exactly where they're going to go, where they're going to operate, or what they can do for a patient without surgery also. So how the docs have used that technology is, I think, the most impressive. Also, in 25 years, I was not in medicine prior to coming to OMNI. So just the confidence that the surgeons have in making these decisions. When I make a decision around here, I may have a couple of days or a week to think about things. When they're in surgery, they have a millisecond. And it's very impressive how that process takes place. And as an administrator here, the docs make decisions quickly, and they're completely competent in what they're going to do, how they're going to do it. So when we make decisions here from a management point of view, I have to cut down that time frame from days to minutes and still make an excellent decision so we can move forward and provide great services to our patients.
Ray, you mentioned that technology, and just earlier we had Dr. Stone Street on, and he's one of the many surgeons that works with the robots that
Yes.
are going on. I mean, did you ever picture that you'd see that in your time here?
No, not at all. But thank God those physicians are entering into that world and taking advantage of the technology to improve outcomes for the patients, and that's what it's really all about.
I mean, in the recovery time anymore. I mean, it's absolutely
Amazing.
It is. And what do you think has been the biggest, I guess, reason for that? Why is it that recovery time, maybe other than technology, other than those things, what's allowing that to continue to improve every year?
I am not a physician, so please, all I can tell you is what I've seen and what they have told me.
Sure.
Okay. What happens is they reduce the amount of cutting, if you will, that takes place, and as a result, the recovery time has been shortened. All right, so there's less impact on the patient physically. So that patient then has a shorter recovery time as a result. And I apologize to all the physicians if I'm not clear about that. But, one of the great things that I'm allowed to do here is not practice medicine. So they don't practice management. I don't practice medicine.
Sure. He is Ray Zinicola. He is the practice administrator here at OMNI Orthopedics. Ray, what are they going to get here at OMNI that they're not going to get somewhere else? I mean, that's a question that people would ask all the time, but what is it?
I will tell you, it has nothing to do with technology, has nothing to do with equipment, has to do with touch. We take care of people. We realize they're coming in for a reason, and we're going to fix that reason. We're going to make them better. We're going to hold their hand. We're going to walk them through the process. We're going to educate the patient as best we can to let them know what is taking place. I'm most proud of that. The employees here actually care. We hold people's hands. We walk them through the building. The building is pretty sizable, so we just don't let people walk around. We take them by the hand, and we take them where they need to be, and we escort them through the entire process. It's easy when you like people, and I think one of the things that we hire here is we hire heart. And we want people who care about people, and across the board. I think one of the most interesting things when we get feedback from people, everyone smiles, and I'm pretty proud of that. So when somebody comes in, they're scared to death, they don't know what's going on, we're going to hold them by the hand, we're going to tell them about the success that we have had with many prior patients, and we fully expect those patients to receive that same care.
Ray Zinicola, practice administrator at OMNI Orthopedics. Thanks for joining me this morning. I didn't get your best Joe Palmisano story, but we'll save that for another time when we can probably say some of the things that happened in that story.
Excellent.
Ray, thanks for joining me. We'll step aside and we'll come back with our final guest of the day, another doctor that specializes in hand and wrist surgery. That when we come back.